So lucky you. You get to hear me second time around this afternoon. I actually haven't prepared any slides for presentation here. Earlier when I was talking, I sort of led you to the point or the conclusion that for small communities and even large communities like Toronto, that we're dealing with a situation where we're needing to provide services to a relatively vulnerable population that experience a range of health disparities, both in terms of their own health care, but also health care access. So how do we deal with that? How do we start to address some of the disparities? And four suggestions, comments, thoughts related to that that I wanted to share with you. And in part, what I'll talk about reflects work that I've done with Hamilton Public Health, for example, and some of the providers, healthcare providers and social agencies within the city of Hamilton, but also discussions with Toronto Public Health and related agencies. So what are they? First of all, I think it's really vital important to say that it's not just healthcare, okay? And that might sound a little bit blasphemous in some respects, and certainly when I suggested that, did a talk with some medical students in the US and mentioned that it's not just healthcare, I could feel the darts aimed at me at that point in time. I hope that we're a little bit more open here, but when we talk about services and improving healthcare and health status, yeah, it's not just healthcare. Healthcare is certainly an important part of what we're talking about here, but we need to think about the broader determinants of health, and that was raised in one of the other presentations that we saw earlier this afternoon. So things like employment services, housing, security, access to food, and so on. Those all play into how individuals perceive and act on their own health care or on their own health status and how they use healthcare systems. Related to that then is the idea of a one-stop shop that more so in smaller centers, smaller towns or cities that are providing health care to an immigrant or vulnerable population, that being able to find those related services under a single roof and having the knowledge amongst providers of where to find, make those connections, okay? So maybe it's not just the healthcare piece, but I'm having problems in terms of employment. And then having, or the ability to provide the direction to those employment type of services is critical, and those play in. So if employment is gained or the employment situation is improved, then that can have a tremendous impact in terms of healthcare status associated with that. Second, again, raised earlier today, but issues around culturally competent care and also culturally appropriate care for newcomers to Canada. So how do you provide that? And certainly, from a physician perspective, there's the need to provide culturally competent care. But keep in mind, too, that culturally appropriate, culturally competent care, it's not just in terms of the interactions between the patient and the physician, the provider. That care starts the moment somebody walks into the doctor's office and meets with the receptionist. The care continues later on in terms of follow-up and assistance throughout the system. So it's ongoing. And it's care that recognizes different cultural backgrounds, the different social roles or cultural roles of men and women or families within the healthcare system. So certainly a need for that. And working with some of the medical residents at McMaster, it's certainly not, it's raised, but there is not necessarily a broad discussion around what culturally competent or culturally appropriate care is. So I think there's opportunities there for improving that. Third observation is part of it, the question that we're looking at is education. So how can we use the opportunities and the resources that we have within our communities in order to provide mentorship and provide the linkages? So we certainly look to the social care providers, the healthcare providers within our communities for that care. But there's also a huge embodied amount of information and awareness and knowledge within the immigrant population, the immigrant community, or broader ethnic communities themselves. We could capitalize on some of those ideas, and I certainly heard, just sort of very briefly, Matt Galloway, CBC Metro Morning, talking with a local provider here in Toronto about how they're using immigrants in order to mentor new arrivals in terms of seeking health care and the importance of health and so on. I think, though, that that's largely an untapped potential, and there's a lot of room for expansion of that role. By doing that, it also provides opportunities to lessen social isolation, to build those social networks that we talked about earlier this afternoon, and provides opportunities then to sort of integrate newcomers into the broader community through recreation or other types of opportunities there. Fourth comment, final comment, is in terms of providers, and whether your own experiences in terms of the healthcare system, that oftentimes it can be a very sort of disjointed or rushed type of experience in and out of a doctor's office. And that's sort of where, I cut short some conversation earlier on, but the importance of listening and understanding and continuity of care in terms of providing that sort of care. Coordination of services across a number of different providers, and understanding how people arrived in the office, contextualizing that care and understanding the journey, that health status isn't just the moment that they present in the office, but understanding the long-term implications of how they came to Canada and what brought them here and what the experiences were en route to Canada. Also related to that provider piece is to destigmatize the locations. So it was a comment that I made in the roundtable discussion towards the end of our last session, that to really sort of destigmatize healthcare issues, and particularly around mental health. So locations that are less threatening or non-threatening to arrival, so that they do feel welcome and want to walk through that door. So I'll leave it at that. Thank you.